Good afternoon to our media partners and those watching on DOH social media channels. Welcome to today's Media Forum, Friday, November 25. Before we start our Media Forum, may I call on Yusek Maria Rosario Singh Berhere for some reminders. Good afternoon po, Yusek.
Yes, magandang hapon, Jolo, and good afternoon to all of you. 4 na araw na lang po, magsisimula na ang ating National Vaccination Days na may temang bayanihan, bakunahan, ligtas, lakas, buong Pinas. Kaisa po ng National COVID-19 Vaccine Operation Center, muli po namin kayong inaanyayahan makilahok at makiisa sa gaganaping malawakang pagbabakuna kontra COVID-19 and live out the spirit of bayanihan. Maari po kayong sumali as volunteers o maari din po kayo magpabakuna ang mga hindi pa nababakunahan ng edad 12 years old and pataas. Maari rin po tayo magpabakuna ng booster doses natin among our healthcare workers, senior citizens, and additional dose for those immunocompromised individuals at yung mga tatanggap ng kanilang second dose para kayo ay maging fully vaccinated na. Pasok po kayo doon sa ating sinasabing National Vaccination Day. Sa lahat po ng gustong mag-volunteer or magpabakuna, makipag-ugnayan lamang po tayo sa ating mga local government units. Kasama po sa aming paanyaya dito sa National Vaccination Days, nais po naming pasalamatan ngayon pa lang ang lahat ng nag-volunteer na ng kanilang oras at resources to make this happen. Libo-libo na ho ang nagparehistro para sila po ay sumama sa ating kampanyang ito para mag-volunteer dito sa National Vaccination Day. So hinihikayat pa rin po natin ang ating mga kababayan na kung sakasakali po na libre po kayo sa mga araw na ito, samahan niyo po kami. Mag-volunteer po tayo, tulungan po natin ang national government. Makiisa po tayo bilang isang sambayan ng Pilipino para po tayo ay magkaroon na ng proteksyon na enough para po sa ating population. We would also like to thank our national government agencies, private sector partners who are supporting the National Vaccination Days, our local governments, our employers, non-government organizations, religious and community-based organizations, and individuals who are encouraging their constituents, employees, stakeholders, or loved ones who are unvaccinated to already get vaccinated. The Catholic Bishops' Conference of the Philippines, who expressed their support to this vaccination drive in their November 16 pastoral letter. Maraming salamat po sa inyo, and of course to all of those volunteers who have signed up already. Maraming salamat po sa tulong na ibibigay nyo para po sa ating sambayanan. Tayo po ay magsama-sama, magbayanihan, at tumulong sa anumang paraan. Kaya po nating labanan ang COVID-19 kung tayo po ay magtutulong-tulong.
Maraming salamat, Yusek, for the reminders on National Vaccination Day. So for our media questions, we go straight to the question of Aiko Miguel from UNTV. For her first question po, Yusek, may target date na po ba ang inoculation ng 11 years old and below? Will it be a phased vaccination and prioritize those with comorbidities or all 5 to 11 age group na po?
Yes, Aiko, no? So wala pa tayong target date for the 5 to 11 years old vaccination. Aantayin natin uli ang emergency use authority na ibibigay ng Food and Drug Administration regarding the inclusion of this specific sector of society, itong 5 to 11 years old. Kailangan po natin uli na magkaroon ng additional evidence kung sakasakali bago makapaglabas ng EUA ang ating Food and Drug Administration. So hanggang hindi pa ho lumalabas ang EUA, let's focus doon po sa mga priorities na ginagawa natin ngayon, lalong-lalo na po yung mga tao or individuals na hindi pa ho nababakunahan and they belong to the vulnerable group.
Maraming salamat po, Yusek. Another question from Aiko Miguel. Do we have an estimate po how many children age 5 to 11 are eligible for the inoculation of COVID-19 vaccines? Will there be enough supply po given the general population is also expected to receive their COVID-19 shot by 2022?
Yes, Aiko, no? So we have about 13.5 million targeted 5 to 11 years old. 5 to 11 years old, 13.5 million individuals po ang target natin para dyan. Meron po tayong enough na supply. Actually, we have about 40 million doses still to come until the end of the year para po dito sa ating pagbabakuna ng COVID-19. So lahat po ng ating priority groups, The rest of the population are already included in our estimates for the committed doses for 2021 dito po sa ating bansa. So we have enough supplies.
Maraming salamat po. For the next question from Caroline Bongkin po of CNN Philippines. For her first question po, how many regions or provinces have already started the rollout of booster for healthcare workers? How about for senior citizens and selected A3 po?
Yes, Caroline, nag-umpisa na po lahat ng ating regions for the booster and additional doses na programa ng ating gobyerno kung saan base sa ating talaan as of November 24, we already were able to give boosters for our healthcare workers at 69,971. For our senior citizens, 21,139. And for those immunocompromised individuals to give their third doses, we had 10,992. Ang total po natin na nabigyan na ng boosters or additional doses is 102,102 across the whole country.
Salamat po, Yusek. Another question from Caroline Bongkin. May we request for a list of vaccination sites for the National Vaccination Day? May we also know if there will still be a vaccination in NCR since mataas na po vaccination sa NCR.
Yes, no. So Caroline, we have 12,000 registered vaccination sites. Baka po dumami pa rin ito sa mga darating na araw dahil marami pa rin hong nagvo-volunteer ng mga mobile vaccination sites o kaya yung mga expansion ng vaccination sites sa different public places like the malls, other establishments, gymnasiums, isasama na rin po. So dadami pa ho yan sa mga darating na araw. Ang National Capital Region po ay kasama rin sa ating kampanya for this National Vaccination Days. They will now be helping or augmenting and give support to Regions 3 and 4A.
Thank you, Yusek. The next question will come from Lay Alvis of GMA News. For her first question po, with the increase of cases in UK and other parts of Europe, kinukonsidera ba ang travel restrictions o mas mahigpit na protocols para sa travelers mula sa mga bansang ito, lalo't papalapit na ang holiday season?
Well, meron naman tayong ginagamit na classification system na in-adapt natin from the CDC and recognized by the WHO kung saan we have classified according to the risk level of each country. Ito yung green, yellow, and red countries natin. For these different countries or this classification, meron tayong kanya-kanyang safeguards or protocols na itinalaga para ma-ensure natin na kahit na iniklian man natin ang quarantine, na andun pa rin yung ating control for our borders. So if you would notice, unang-una, ang requirement natin, dapat fully vaccinated ka for you to be able to enjoy the privileges of having shorter quarantine. Pero bagamat shinorten natin yung quarantine natin, meron pa rin tayong safeguard. Katulad for yellow countries, we have 72 hours pre-departure testing, and then we have 3 days quarantine here in the national facilities and with the 3rd day testing. So with that, napag-aralan niya ng mga eksperto natin that because they are fully vaccinated and they are coming from a yellow country, hindi po natin mapapalusot pa rin with this kind of monitoring or protocol. Ito po mga dadating sa atin at maaring pumunta sa komunidad na may sakit. Kung sakasakali naman, may another layer po tayo ng ating mga protocols. Pagdating nila sa community, they have to self-monitor and local governments are mandated to monitor also all of these individuals who are coming home to their communities.
Thank you, Yusek. Another question from the Alvis po. With a national positivity rate of less than 5%, even reaching 2.3%, masasabi bang under control na ang COVID sa Pilipinas?
We can't definitely say that, Lay. Marami pang uncertain sa nangyayari sa atin. Na-experience na natin in the past, na napababa natin ang ating mga kaso, but after some time, tumaas pa rin. So kailangan natin ng longer period to assess and to evaluate what's happening. Kailangan din natin makonsidera, meron pong iba't ibang settings at iba't ibang sitwasyon ang bawat regional area natin. So maaari na ang NCR, mataas na ang bakunahan dito, tapos ang ating community response has been intensified. But if we compare to other areas in the country, some of the areas in the country, mababa pa rin ang pagbabakuna. Nakikita pa rin natin na kailangan pa natin tulungan ng local governments nila for them to intensify their community response. At saka pangatlo, kailangan handa ang health system kapag nasabi natin na nakakapag-control tayo ng isang sakit. So, kailangan pang pag-aralan maigi, further studies, further evaluation, because a lot of things are very uncertain at this point.
Thank you, Yusek. The next question will come from Red Mendoza of The Manila Times po. In a media conference po, a real-world study from San Marino said na Sputnik V remained 80% 6 to 8 months after second dose. Do you think the administration of boosters for Sputnik vaccines will be affected due to this new real-world data po?
Red, unang-una, yung real-world data na yan was just an article which was issued by the Russian Investment Fund. Hindi pinakita yung kabuuan ng study nitong sa San Marino na sinasabi. So kailangan natin i-verify, kailangan natin tignan din kung peer-reviewed na yung study. Kasi kapag peer-reviewed na yung study, ibig sabihin completed study yan. Now, if this is a completed study, this is good news for all of us because one vaccine is showing that after how many months, nakakapagbigay siya ng datos na epektibo pa rin siya. Although hindi natin masasabi yan sa ibang mga bakuna sa ngayon dahil yung mga pag-aaral natin incomplete pa. Pangalawa, ang booster or additional dose, you give the boosters when the immunity is waning. You give the additional doses because you were not able to mount the response appropriate for that vaccine that was given to you. So if you have this kind of vaccine which can last until 8 months and you still have 80% effectiveness, and then your booster dosing will just be delayed, if ever, no, na kumpleto na talaga itong ebidensya. But for the additional dose, that's a different story. It's not going to be affected by this kind of studies.
Maraming salamat po, Yusek, for the clarification. Now, we will be moving on po to some of the Zoom and Viber chat questions sent by our media. So for the first question po, it will come from Mads Villar. Yusek, Mads Villar is asking lang po for a clarification. Yung binanggit niyo po ba sa webinar na data, yung willingness ng mga Filipino na magpapavaccine, nasa 64% na po. Then may binanggit po na 70% of Pinoys willing to be vaccinated but half are uncertain, then half is uncertain. Tama po ba ito?
Yes, Mads, no? So klaruhin natin. Dito sa SWS survey, may sinabi 64% are willing to get vaccinated. When you say it's willing to get vaccinated, component niyan, we included yung certain and uncertain. So among the 64%, yung kalahati po niyan ay uncertain, yung kalahati ay certain. So kaya sinasabi natin, we are focusing on those individuals who have included as a secondary question yung uncertainty nila dahil nag-aagam-agam sila for various reasons. At yun po ang ginagawa natin ngayon ng mga strategies for us to be able to shift their mindset at maging certain sila sa pagbabakuna. So this kalahating certain, kalahating uncertain is from the 64% who said they were willing to get vaccinated.
Maraming salamat po, Yusek. The next question will come from Catherine Gonzalez po. Her question po, what is the reason behind the increase in percentage of severe and critical cases among active cases of COVID-19 from 10.5% severe and 4.5% critical po kasi on November 14. It increased to 14.4% severe and 6% critical on November 24.
Yes, no, Catherine, let me clarify this. Unang-una, wala pong pagtaas ng severe and critical cases among our monitoring of the different hospitals in the country. What's happening right now, unang-una, because bumababa po ang ating mga active cases, so definitely it's a function of the number, tumataas ang porsyento ng mga severe and critical. Dahil nga po, lumiit na yung ating denominator. Pangalawa, we have observed also, since ang severe and critical cases po kasi, hindi natin siya sinasama sa time-based tagging. Kung babalikan po natin kung paano natin ginagawa ang time-based tagging, we try to look at lahat po ng mga mild asymptomatic and moderate, pag nakarating na sila ng 14th day, without further validation pa lang ng local government, tinatag na natin sila as recovered. Kasi isa yan sa gaps ng sistema natin na ang local governments, before they can finally validate that the person has already recovered, it will take them a longer time. And kaya naiipon po, dumadami ang active cases natin when in fact, hindi naman po ganun talaga ang reality sa ground. Kaya mapapansin din nyo po, pag naglalabas po tayo ng case bulletin every day, meron po tayong statement doon na sinasabi na after further validation, this number of recoveries, for example, or this number of mild and asymptomatic who has recovered were actually deaths or were actually this status. No? Kasi nga, pagkatapos natin silang i-time-based recover, dadating po ang LGU validation, nagkakaroon po kami ng reconfirmation. Dito, sa ating ginawang proseso na ito, hindi natin naisama ang severe and critical because we wanted to make sure na yung ospital ang magsasabi sa atin na they have already recovered. So we are now coordinating with our local governments to fast-track the validation of severe and critical. Naiiwan po sila dun sa database when in fact, when we started validating from the DOH side, nakita namin marami na dito sa mga taong to recovered na pala. Hindi pa lang nasasubmit ang report. So this is a function of reporting naman. So again, let me just reiterate and clarify, wala pong pagtaas ng severe and critical cases among our hospital admissions dito sa ating bansa.
Maraming salamat po, Yusek, for the clarification. The next question po will come from Mela Lesmoras of PTV. For her question po, sa IATF meeting ngayong araw, kasama sa agenda ang pagtatalakay kung dapat nga bang ipagbawal muna sa labas tulad sa malls ang mga unvaccinated children. Ano ang ihahaing posisyon ng DOH ukol dito sa IATF?
Well, our position have always been the same. When we recommended the different safeguards for the different alert levels, napag-aralan na po yan ng ating mga eksperto, napag-usapan na. At meron tayo mga scientific basis for that. So when we recommended that these are the different protocols for alert level 2, for example, na kasama dyan ay ang paglabas ng ating mga kabataan, ang objective natin nung pinalabas natin ng mga bata was because first, we would like for them to interact with other children, for them to get some form of exercise outside of their homes, and for them to get adequate sunlight, which is needed for their health. So yan po yung basic objectives natin. Hindi po kasama sa objective ng ating ng IATF actually, na palabasin ng mga bata at dali natin sa mga matataong lugar. Hindi po yun kasama. Kaya maya't maya po kami nagpapaalala sa ating mga magulang. So ang ating posisyon, ang atin pong binigay na protocol o rekomendasyon ay naandyan na. Ito po ay pinag-usapan at nirekomenda ng ating mga eksperto. Ang kailangan po natin talaga ngayon is to monitor and to enforce. So we are calling on our local governments, the different private establishments and public establishments. Let's be true to that capacity that was given based on the different alert level. For alert level 2, the capacity indoors is just 50%. But we are seeing right now, establishments are full. Pag pumupunta po sa mall, punong-puno ang mga tao. That is not 50%. So we cannot safeguard yun pong ating mga kabataan or even the other vulnerable or tayong lahat kung hindi po tayo magtutulong-tulong para ipatupad ang mga protocols na napag-aralan na ng ating mga eksperto. So our position, we should not limit or restrict again our children of being locked inside our houses. Tayo po ang gumawa ng paraan. Unang-una, ang mga local governments at saka mga establishment, let us enforce what is stated in the protocols of IATF. Pangalawa, ang ating mga magulang, pag nakita na ho nating masikip, maraming tao, hindi pwede mag-physical distance, wag na po tayong tumuloy kung kasama po natin ang ating mga anak.
Maraming salamat po, Yusek, for the clarification, and those are all the questions that we can accommodate for today po. For questions regarding the National Vaccination Day, this will be given by NVOC po in the upcoming days. Yusek, before we close po the media forum, may we request po for your final message po to our kababayan.
Yes, maraming salamat po for today. Gusto lang ho namin ipaalam sa inyong lahat that we will not have a media forum on Friday and on Monday because we are giving way to the preparations for the National Vaccination Days which will happen on Monday, Tuesday, and Wednesday. Gusto namin magpasalamat sa ating mga media partners dahil alam po namin katulong po namin kayo sa pagpapakalap ng tamang impormasyon sa ating mga kababayan. Bagamat patuloy na pong bumababa ang ating mga kaso sa bansa, kinakailangan pa rin pong ipagpatuloy ang ating mga kasangga o yung mga ginagawa nating standards or safety protocols laban dito po sa pandemyang ito. Iwasan po natin na magiging kampante tayo sa panahong ito. Let us always be cautious, let us always be focused, let us always be alert. Huwag po natin ibababa yung mga guards natin. Kailangan lagi pa rin po tayong protektado. Atin pong isapuso at isaisip ang kahalagahan ng pagsunod sa minimum public health standards, baksa at centers ng mga volunteers para sa darating na National Vaccination Day from November 29 to December 1. Nangangailangan po tayo ng dagdag na health screeners, vaccinators, post-vaccination monitoring personnel, health educators, data consolidators, and encoders at mga tatao sa registration sites. Para po sa mga nagnanais mag-volunteer, ay scan lamang po ang QR code na ito na naka-flash sa screen para po kayo ay marehistro. Nananawagan din po kami sa ating mga local governments. Marami na pong tumatawag sa amin na nagpa-register, nakapag-scan ng kanilang na magpa-register para mag-volunteer. Ngunit hindi pa rin po sila nabibigyan ng abiso ng kanilang mga local governments kung sila po ay natanggap na at kung saan po sila i-assign come our National Vaccination Day. So please, let us try to facilitate the process para po magkaroon na ng assignments ng ating mga volunteers na nakapagrehistro na. Ang pagtutulungan at pagmamalasakit ay makakatulong po sa pagsukpo ng pandemyang ito. Alalahanin po natin sa pag-iingat, hindi lamang po ang ating sarili ang naproprotektahan natin, kung hindi na rin po ang ating mga mahal sa buhay at ang ating komunidad. Ipagpatuloy po natin ang ating pagkakaisa at pagiging bida solusyon plus kontra COVID-19 nang sa gayon po ay tayo ay makatapos na dito po sa pandemyang ito. Again, nananawagan kami, National Vaccination Days, November 29 to December 1, 3 araw po ito, magbabakuna tayo. Our target is 5 million jabs per day. Marami po tayong vaccination sites. May mga iikot din po sa ating mga komunidad para magbigay ng mga bakuna para dun sa mga taong hindi makakapunta sa vaccination sites. We enjoin everybody. Magtulong-tulong po tayo bilang isang sambayan ng Pilipino para po tayo ay makalagpas na sa pandemyang ito. Maraming salamat po sa inyo.
Maraming salamat, Yusek, and maraming salamat rin po sa ating media partners. Stay safe po lang.